All right. Welcome, everyone. My name is Corinne, and I will be your moderator this evening. I'm excited to welcome Dr. Melissa Shotell, a board certified orthodontist, as our speaker this evening for a review of the advantages of using a digital workflow with an emphasis on intraoral scanning and 3D printing. Before we get started, I would like to take a moment to go over some quick housekeeping. If you have a question, please type it in the Q&A section, and we will answer questions live at the end of the webinar. CE is also not available for this webinar live or on demand. Dr. Shotell, welcome. Thank you so much for being here with us tonight. I'll pass it on over to you.
Thank you so much. It's an absolute pleasure to be here with you this evening. We are going to be talking about two of my favorite topics. We're going to be discussing technology and the use of clear aligners. So thank you to everyone who's joining us this evening. I'm going to go ahead and turn my camera off so that I can go ahead and make sure that my videos stream well, and I'll turn it back on for the Q&A. And I am going to save a little bit of time at the end for questions and answers. Well, thank you so much for that lovely introduction. Today, we're going to talk about the digital workflow for clear aligners. And what I'm really going to focus on is how you can utilize technology that you already have or that you're looking to acquire for restorative dentistry, and how you can implement a clear aligner workflow utilizing that technology so that you can use it for two purposes. A little bit of information about me. I went to dental school at Nova Southeastern University in Florida, and then I did a GPR residency at The Ohio State. I went to clinical practice, and I practiced as a general dentist for 4 years before I returned to Loma Linda to do my orthodontics residency. So really, after all of my experience in general dentistry, one of the things that I found was really the love that I have of working with orthodontics to bring the teeth into the proper position for restorative treatment. And I currently work in an interdisciplinary practice in Sonora, California with a prosthodontist. And this is what I spend a lot of my day doing. So today I want to really focus on the patients that you're going to be seeing in the general practice that can benefit from orthodontic treatment, and for specifically with clear aligner treatment. So I am a diplomat of the American Board of Orthodontics, and I am faculty at 2 dental universities, at the University of Alberta and at the University of Nevada in Las Vegas. Please note, I am a registered speaker for Henry Schein and for Henry Schein Orthodontics. And I would like to thank Henry Schein for sponsoring tonight's webinar so that we all have the opportunity to discuss technology together. So why would you want to focus on orthodontics in a crown and bridge world? I know for many years when I was in private practice, I would have at least 2 or 3 patients a week ask me about orthodontic treatment. And I was very fortunate. I had an orthodontist that worked in the practice I was in as a general dentist, and she came into the office 2 days a month. And this was really a challenge for some of my adult patients because they weren't available on the days that she was there. So this is where I really began looking more heavily into orthodontics and specifically into clear aligner treatment to see how I could help patients. You know, for me, the main reason that I wanted to really be able to look at orthodontics myself was that I wanted to be able to give more longevity to my restorative treatment. I wanted to be able to put the teeth into the proper position, relieve any traumatic occlusion, give my patients proper overjet and overbite, because not only would I be able to maintain their natural dentition longer, but I also wanted to make sure that any of the restorative work that I was doing would have as much longevity as possible. It's often so easy to recognize those really difficult orthodontic cases, but what we often miss are those very, very simple cases that come through our practice every day. And often looking at a tooth that needs a crown and seeing the occlusion with it and saying, well, if we put that tooth into a better position, how can we improve the longevity of the crown and of the tooth itself? So for me, that was really a strong focus. And I know for many of the doctors that are on the call tonight, they're really trying to see why they would want to bring orthodontics into their crown and bridge world. And I've given you some of the restorative reasons that I have and some of the reasons why I looked at this treatment. But to be honest, when we're thinking why clear aligners, well, your patients are asking for them. The only challenge is often they're not asking you. They're asking Dr. Google. And I know from talking with many doctors throughout the country, Dr. Google is just as prevalent in California, where I practice, as it is throughout the country. And in fact, if we want to know how many times patients are talking to Dr. Google about clear aligners themselves, the research has shown that there are approximately 2 million searches in the search engines for clear aligners every month. That's not every year. This is every month. This is how many times people are going online and they're searching for clear aligners. Maybe they're looking for more information for education. Maybe they're looking for a provider in their area. So this is an area of treatment that's receiving a high amount of attention right now. And a lot of it is patient driven. As we saw from the last few years, patients have really become conscious of dental aesthetics. And a lot of that is from how much time they spend on Zoom. Now, I am fascinated that the Zoom effect has brought so many patients into my office that they tell me that they saw themselves on a Zoom call, and maybe they were with their colleagues, or maybe it was for their child's school. And when they were on a Zoom, they could see their teeth. Well, I know when I'm on a Zoom like I am this evening, to me, it's a pretty small little picture. It's a fairly small thumbnail. However, I always am curious to see how the large mirror across the sink in the bathroom wasn't enough to see their teeth. But for me, I'm happy with either source. If they notice their teeth at home or if they're noticing them on a Zoom call, what matters is that patients are noticing their teeth and they're driven to seek more aesthetic options than bracket and wire. Now, many patients come in and they're concerned strictly with aesthetics. However, we have the wonderful opportunity to educate them about occlusion and the dental conditions that they're suffering from and how we can help to improve their oral health by getting their teeth into the proper position. So for me, Zoom and Dr. Google have been something great because they are driving patients to my practice. Now, I know what many of us are also seeing is that many dental offices are quite busy right now. When you look at your schedule for the day, you're probably saying, well, how am I going to incorporate clear aligners into my day when I already have a pretty busy schedule? And what we're going to focus on today is how to delegate to our staff to really help us with a lot of the records process so that we can minimize the doctor chair time and make this a team activity within our office. I know my team is just invaluable to me in this process to be able to help me with the records, and they love it. It gives them a chance to interact with the patient, and it gives them the opportunity to have great discussions with them about their teeth and about possible treatment when the patient's having aligners, and to really go through the educational process about clear aligners. So by the time I get to the chair, the records are done. The patient understands how they have to wear the aligners. And then all I have to do is the diagnosis and then work through the treatment planning process. So for many of us, we can find that extra time in our schedule as long as we're relying on our team to help us. And what I really want to chat about is how using digital technology can help to simplify this process. For me, intraoral scanning has been the number one factor that has made clear aligners more accessible to me and my patients. Many years ago, when I had to take full arch polyvinyl impressions to do clear aligners, that was a big challenge. No one really likes holding impression in the mouth for 5 to 6 minutes while it sets. So when we look at the incorporation of the digital technology that we have, many of you have already implemented this for crown and bridge treatment or for implant treatment planning. You can now just give it a dual purpose within your office. So by looking at our intraoral scans, our cone beams, and our other digital technology, we're going to be able to repurpose that both from our restorative sphere into our clear aligner sphere while we're treating our patients. So let's take a moment and let's look at the digital workflow for clear aligners. We're going to start with our digital records. We're going to work through a digital treatment planning process once our records are taken. We're then going to take a look at the clear aligners themselves and the characteristics of the aligners that can help us to deliver outstanding treatment results. And for those doctors that want to kind of push the boundaries a little bit, we can see how we can combine this with 3D printing, because 3D printing is a rapid growing area in the clear aligner space right now. So let's take a moment and let's focus on our digital records. When we're ready to get started with our clear aligners, we're going to take several different records for our patients. We're going to take an intraoral scan. We're going to take a set of photographs. We're going to have 5 intraoral photos and 3 extraoral photos. And we're going to take either a Panorex or a cone beam on the patient. Let's take a look at all 3 of these different areas of the records in a little more detail. I like to focus on our digital impression first, or our intraoral scan, because for me, this is truly the foundation of treatment. We need to have an outstanding digital scan to make sure that we have an exceptional fit for our clear aligners and an excellent fit in the mouth. For most of us on the call this evening in restorative dentistry, you're probably used to taking quadrant style digital scans, more similar to what you would have taken with a triple tray with polyvinyl. And that's for our crown and bridge space. When we're taking intraoral scans for clear aligners, we have to follow some very specific guidelines to make sure that we get an accurate scan of the entire arch and that we've captured the width of the arch. So I always recommend referring to the intraoral scanner that you have. It will have a designated scan pattern that's recommended. However, there are certain characteristics that you need to see. Now, the beauty of intraoral scanning versus taking a polyvinyl impression is when you take that intraoral scan, you can look at it right there on the screen and see if you've captured the details that you've needed. I can say for myself, I have never had an intraoral scan rejected for my Reveal clear aligners. However, over the years, I can't tell you how many times I would take a perfect polyvinyl impression and I would think it would come out absolutely flawlessly. And then I would receive a copy of the digital model back showing where there was a bubble on a tooth or a small area with a void. So for me, intraoral scanning has been really what has expanded my clear aligner practice because of simplifying the records process and avoiding rejected polyvinyl impressions. So after taking the intraoral scan, you should be checking it for several things. You want to make sure that you have captured all of the teeth and the soft tissues, and you want to make sure that there are no voids in the scan. You also need to capture 3 to 5 millimeters above the gingival margin of the soft tissue. Now, that's probably the most important point. And if you leave here with one tip on intraoral scanning and record taking, that'll be the one that I want you to leave with today, that you always need to capture 3 to 5 millimeters beyond the gingival margin. This will tremendously enhance the fit of your clear aligners. This is because what happens after we've taken the scan? When we take an intraoral scan and we send it to Reveal for our clear aligners, the technician is going to start by checking and making sure that there are no voids and that the teeth were captured. They're then going to put a digital base onto the model, the same way you would pour a base on an impression. If we haven't given enough space above the gingival margin to place the base, you risk the base coming down and contacting the gingival margin of the teeth. And this is where you'll end up with a clear aligner that is lifting away from the teeth or lifting away from the gum tissue, and it can irritate the lips. We want to have a really tight, intimate fit of the aligners against the teeth. So when you capture that extra 3 to 5 millimeters above the gingival margin, you're helping in the manufacturing process later. So please write that down. Make sure that that is the tip that you take with you today. We also want to make sure that there is no distortion and that we're following the proper scan pattern for the scanner that we're using. My recommendation is to scan every patient. I love seeing this done in a restorative practice because this gives a tremendous communication tool for you and the patient. This is something that can be incorporated at your hygiene visits and have the hygienist assist you with on recall visits. Or you can do this at your new patient exams when you're doing your records and data collection. Ideally, I like to see it done at that initial patient appointment when you're taking their full mouth series or you're going to take their Panorex, when you're doing your charting. That's a great time to have had your assistant to capture an intraoral scan so that you can bring it up on the screen and use it as a communication tool for the patient. This is going to help long-term with your case acceptance because patients like visual things. They like models that they can see. They like diagrams. And when you bring up their teeth, often a patient, they don't understand what their occlusion is or where the teeth should be or putting the teeth in the proper position. So I recommend scanning every patient because you'll begin to see those areas of spacing and areas of crowding and rotations that can benefit from clear aligner treatment. After we've taken our intraoral scan, you're going to take the patient's photographs. Now, I hope this isn't the way you're taking photographs with your Polaroid camera, but rather with a digital camera. And many of the offices that I've worked with over the years have a broad range of different types of cameras. So the two on the left, or the one on the left and the one in the center, are examples of cameras that I use in my practice. I have a digital SLR. I also have a digital point and shoot with a special lens diffuser. But many doctors that I work with in many offices, they'll use an iPod or an iPhone that's no longer used as a telephone to help capture scans. So photography is really important because this is what is used to compare the intraoral scans if there's any questions on the occlusion. These are also a tremendous builder for your practice so that you have your before and your after photos. When you're taking the patient's records for clear aligners, you're going to want to take the 5 intraoral photos that I've shown. You're going to want to take a frontal photo and then buccal photos of the right and the left side. And then you're going to want to take an occlusal photo of the upper arch and the lower arch. And photography is a topic that I could talk about all day. But you can see here how all the soft tissue is moved away from the teeth. This is where you'll want to use some cheek retractors. And then you're going to want to use a mirror to capture those occlusal photos so that you make sure to capture the occlusal and incisal surfaces of the teeth. If you want more information on photography, you can always refer to Reveal for the photographs that are recommended. You're also going to take 3 extraoral photos. Make sure that the patient's hair is pulled back so you don't get any shadows on the face. And you're going to take a photo of the patient smiling, a picture of the patient relaxed with no smile, and then a profile photograph from the right side. And as you can see here, I have this patient standing against a wall. I recommend always having the patient get up out of the dental chair and stand against a wall, because this is how you'll be able to see more of the natural angle of their jaw and the normal position of their head. If you have the patient actually sitting in the dental chair, leaning backwards, sometimes they don't know whether to put their chin up or their chin down. Having the patient stand for a photo is much easier. After we've taken our photographs, we're going to take our radiographs. Many doctors like to take a panoramic and a Ceph Some prefer to take a cone beam. Some will use an FMX or a Panorex. Reveal does request that you send at least a Panorex for them to review when doing the treatment setup, because it's important to see the positioning of the roots of the teeth to see how they are going to move and to make sure that there are no interferences of moving the teeth. I recommend taking a Panorex, and actually in my office, what I utilize is a cone beam. I like to use a cone beam in all of my younger and growing patients because I'm able to then compare when I take a second cone beam how much they've grown. From the cone beam, you can always construct the Panorex and the lateral ceph, so you have those for the patient records. It also shows lots of valuable information like a three-dimensional view of the TMJ joint and also their airway, which is becoming a growing area of interest in dentistry. I know not everyone has a cone beam available to them. I do use it myself in my office, and I use it for all of my complex adult cases and all of my tooth impactions as well. However, for the aligners, Reveal does request a Panorex. After we've taken our digital records, we're going to be ready to go through the digital treatment planning process. And this is going to be done by taking and sending your records. First, you're going to capture your intraoral scan, your photos, and your Panorex. And you're going to take those and you're going to submit them through the doctor portal to Reveal so that you can begin to have the treatment setup created for your patient. Once those have been sent, the technicians at Reveal are going to create a customized treatment setup for your patient, and it will be returned to you, as you can see in the photo here, like a little video. You can always make any modifications to this that you would like. You can take and manipulate it on the screen and move it around. For me, I found that this is a great way to show my patients their anticipated results and to answer any of the questions that they have about their clear aligner treatment. What I like about the software that's used through the DDX portal for the Reveal aligners is the ability to make any customizations myself. You can always ask the technicians to make any customizations or any changes for you, or you can make these yourself in the software. I myself like to take and, move and manipulate the teeth to the position that I want, or to make any changes to the areas of the attachments or interproximal reductions. The nice part is that you have both options available to you. You can either type a note into the treatment setup and ask the technician to make the changes for you, or you have the ability to grab and manipulate the teeth, the attachments, and to add any cutouts or any elastic slits to the aligners. It's all your choice. Once you have the treatment setup that you want, you can approve that, and the aligners will be manufactured and they will be shipped to your office. So as we continue with our digital workflow, let's take a moment and let's discuss the characteristics of clear aligners and how to communicate with your patients when they have clear aligner needs, and so that you're ready to deliver those aligners and to discuss them with your patients. So let's take a look at the Reveal aligners that we have available from Henry Schein. When a Reveal case arrives at your office, this is what it's going to look like. It'll arrive in beautiful packaging with a retainer case, and it'll have a guide for your patients. There are some very specific characteristics of Reveal that are unique to Reveal and that help with the mechanical properties of the aligners themselves. So let's go ahead and take a look at when we are looking at our clear aligners, kind of the anatomy of the aligner itself. Whenever we're looking at a clear aligner, we want to make sure that it has an excellent adaptation and fit to the teeth. The more tighter and intimately the aligner fits to the teeth, the better force transfer we will have from the aligners to the teeth, creating the movements that we need. So when you're looking at the aligner, you always want to see initially, there will be some very, very small spaces, and those are the spaces for the teeth to move into after it's been worn for the prescribed amount of time. I typically have my patients wear their aligners for 2 weeks each. So if an aligner is brand new, you may see a very teeny tiny space in the various areas where we want the tooth to move to. However, once it's been worn, it should fit like a glove against the teeth. When we see the Reveal aligners, they have an optimized trim line that extends to slightly above the gingival margin. And this helps to enhance that force transfer by reducing the flexibility of the aligner. A flexible aligner is not going to apply as much force to the teeth as a more rigid aligner. And when we extend that trim line up above the gingival margin, we're placing more of the area of aligner coverage against the gingival third of the tooth. And this is the most critical area for controlling our forces. So looking at that optimized trim line, it gives a lot of mechanical advantage to the Reveal aligner. The Reveal aligners are made of a clear wear material. It is crystal clear, very stain resistant. When I see my patients and they've been wearing their aligner for 2 weeks, it's often surprising how clear the aligner still is even after wear because of the unique clear wear material and its stain resistance and its high clarity. We also want to make sure when we're checking our aligners that they have a beautifully finished edge that's smooth so that the patient won't feel them. We want to make sure that that sits right up against the edge of the gingiva so that they don't have a gap between the gingiva and the teeth, so that it is very, very smooth to the lips when they move over them when they're speaking. So when we compare the Reveal aligners to other aligners, you really want to take a look at the difference in the material itself, the clarity, and the fit to the teeth. So as we can see here, we have another aligner, and then we also have the Reveal aligner, and you can see some of those different characteristics that we were talking about. Unique and proprietary to Reveal are the holds that are placed in the aligner. And combining the trim line with the holds creates a very unique mechanical set of forces that can help us to really reduce our number of attachments and also to reduce the number of aligners that the patient needs. So if we take a look at the tooth diagram on the right, we can see where the little holds are. We're going to see that that optimized trim line is extended just beyond the gingival margin. And then the hold is a positive pressure point that is placed into the aligner to fit and make it nice and snug, almost like a collar up against the tooth, or maybe how on the end of a sleeve, how you'll have an elastic cuff, giving that little bit of pressure at the end. This is going to help hold the aligner on the teeth. And between that optimized trim line, reducing the flexibility, and then the holds, really helping to hug the aligner to the tooth, we're going to avoid the aligners slipping and pulling off the teeth. This is going to help transfer more force from the aligner itself to the teeth where we need the movement. I know this is a lot of information to take in, but what we're really looking at here is that we're not only designing the movement of the teeth and how we want the teeth to move, but we're designing the aligner itself to have a better mechanical advantage to help move and assist in the movement of those teeth. If we look a little bit closer at the trim line, you can see some aligners, they will scallop the trim line in between the areas of the teeth in the interproximal embrasures. With the Reveal, the area of the interproximal embrasure of the tooth is covered by the material that extends up over the papilla and up to that optimal trim line just above the gingival margin. When we look at this area a little bit closer, we can see the areas here that are highlighted in pink and all the areas of extra material in the aligner when you extend the trim line. And when you wrap into those interproximal embrasures, you have all the areas that you are lacking when you scallop the trim line. By having these areas that are included with the optimized trim line and going over the embrasure spaces, we're going to wrap the aligner in the areas of the interproximal embrasure. This is going to give you a tighter fit of the aligner to the teeth and allow for more force transfer from the aligner to the tooth itself. This works because you are enhancing the fit and creating that nice, tight, snug fit, but also placing more material into that gingival third of the tooth where we want to control the forces the most. We also will see here that this will really decrease the flexibility as well with that optimized trim line, and it will help to avoid the aligner slipping off the teeth. The goal is to keep the aligner on the teeth as tightly and snugly as possible. And what Reveal has done by adding the holds into the aligner, by really filling in those interproximal embrasures and extending that trim line, what that does is it enhances the mechanical efficiency of the aligner and of the aligner material itself. And that lets you do a few very important things. It lets you reduce the number of attachments that are needed in the case so that you spend less time bonding attachments on and taking attachments off. But because you're being more efficient with the mechanics, you can also reduce the number of treatment steps. So maybe instead of having a set of 20 aligners, you might have a set of 15 or 16 aligners. And for most adults, that's a huge advantage because they don't want to be in treatment any longer than they have to. We can also utilize that mechanical advantage to help reduce the number of refinements and revisions. And by decreasing the number of attachments and by utilizing that optimized trim line, we can help reduce patient discomfort. A lot of patients don't like the feeling of attachments bonded to their teeth, the time it takes to bond them, and the time that it takes to take them off and to debond them. So when we can reduce those, we can help to eliminate some of the areas of patient discomfort. And by reducing the number of treatment steps and having more mechanical efficiency, reducing refinements, we can also reduce the treatment time. So really a lot of fantastic engineering into the design of the Reveal aligners, and we can see the benefits for the patients. Now, the most important part after we've looked at our digital workflow, after we have seen how to take our patients' records and how to go through the treatment planning process, but really we need to see how to identify these in our office. I always say that clear aligner patients are hiding in your practice. You just have to find them. And it's amazing how easily it is to sometimes miss very simple aligner cases because we are not talking to the patients about aligners as much. If you're using photography or the intraoral scans in your office as a communication tool, often the patients will see areas of crowding or areas of spacing, and they'll begin to inquire more. Or patients that weren't interested initially, they'll become more and more interested after they see the spacing or the crowding on the screen from that intraoral scan. So when we're looking for those patients, it's really important to enlist our team so that they're helping us to communicate with the patients. When they're taking that intraoral scan, encourage your assistants to show the patient their intraoral scan. My patients are really impressed. They often ask me if they can take pictures of them on the screen so that they can show their colleagues at work. So really working with your hygiene team and your assistant team to look for those patients that are maybe they're inquiring about whitening. Maybe they're interested in bleaching their teeth. Those are also often patients that are really interested in aesthetics and cosmetics. And they may not understand that they're a great candidate for clear aligners too. However, when we begin everything new, I do recommend that you follow a couple of guardrails. And the clinical team at Reveal does have some recommendations. If you reach out to Reveal, they should be able to share these with you. But there are 3 types of Reveal cases. There are express cases, which are 1 to 10 sets of aligners, light cases, which are 11 to 20 sets of aligners, and their standard cases, which are an unlimited number of aligners for up to 3 years. And I always like to think of these as my simple, my moderate, and my complex cases. And we can see here that there are listed different types of malocclusions and different conditions that fit really well into these cases. As you get started, I recommend really focusing on express cases, looking for patients that are already class 1 occlusion, and they just have mild crowding, spacing, really just cosmetic alignment of the teeth. Now, for me to look at a list of measurements like this is a little bit challenging. I prefer to look at it more from a diagrammatic aspect. So this is a diagram showing the express cases in the teal color, the more moderate or light cases in navy blue, and those difficult or complex cases in peach. And we can see here that if we're looking at areas of crowding or spacing that are 3 millimeters or less, those are often great cases that can be treated with 10 aligners or less. If we look, for instance, though, at overbite and overjet, those numbers go down a little bit. These can be some excellent guidelines to help you when you're getting started. But again, I recommend starting with more simple cases so that you really set yourself up for success. Unfortunately, it's really easy to identify those complex cases. It can sometimes be a little bit harder to find those express cases, but these are often the patients that come into your office that had orthodontics before and have had some orthodontic relapse. So let's look at a fantastic beginner case. This is one that came into my office. This gentleman came in and he told me that his chief complaint was that lower incisor that we can see that is tipped lingual and is blocked out of the arch. And the first thing he let me know was that he had had orthodontic treatment when he was younger, and he doesn't like that his teeth have moved. When I asked him about his retainers, he let me know that he didn't think that he had worn them since they were given to him. And as we can see here, this is where he finished. This took 8 aligners, and then I did 3 refinement aligners for him. So a total of 11, but my initial case was an express case with 8 aligners and then a refinement of 3. And we can see here the difference. This made a tremendous difference for him. And this treatment took about 5 months in my practice. So really taking a look at this and seeing how just a small number of aligners can make a huge difference for a patient. So as we continue this evening, looking at the use of digital technology in our offices and how we can utilize various technology for multiple uses, let's take a little closer look at 3D printing. Now, for those of you that are first getting started with clear aligners, you're probably going to really want to stick to utilizing your Reveal aligners and working with a laboratory. However, if you already have 3D printing in your office, there are some areas that you can use to help supplement this. So I'm sure some of the doctors on the call probably have a 3D printer. You might be printing occlusal guards, maybe surgical guides. For me, 3D printing is not just the future, it's the now. And this is a really fantastic way to incorporate something new into practice. If you want to begin utilizing 3D printing to help you with your orthodontics cases, you're going to need some equipment, but a lot of this you may have from the restorative space. You're going to want to have that intraoral scanner, your optical scanner. If you already have your 3D printer, then you already have a wash and cure station. And if you want to work with your retainers or with clear aligners, you'll need to have a vacuum forming unit as well. So just taking a look at the equipment that you'll need, you will need a little bit more laboratory space as well if you are in the 3D printing sector. So for me, the easiest way that I see to get started with 3D printing is with retainers and with replacement retainers. I have a lot of patients and adults that come to my practice because their orthodontist has retired and their dentist does not make retainers. So they'll come to me wanting a vacuum form retainer. These are those great cases that you can find in your office where you can take an intraoral scan and then 3D print their models and make a vacuum form retainer for them. One of the other ways I like to utilize this workflow is to do some of my same day starts. Now, we're living in an era where patients want everything now. They want everything fast. They often are having a very emotional purchase when they decide to get started with their clear aligner treatment. And for many of them, they want to feel like they've started and that they've accomplished something that day. Well, what I've done in my office is what I will do is I will take the intraoral scan. I will go ahead and I will let the patient know that we can get started that day. I take their full set of digital models. I take their intraoral scan, I take their photos, I take their cone beam, and then I will go ahead and print and 3D print a model, and I will make a vacuum form for them. And I'll deliver it that same day so that they can get used to the feeling of it. They can get used to taking the aligners in and out. And with the material over their teeth, they'll often feel that very tight sensation. I like to think of this as like a trainer aligner. I let them feel what it's like to wear them and to make sure that they're going to be able to be compliant and to wear them 22 hours a day. Then what I'll do is I will take their records and I'll send them off to Reveal to have my treatment setup created. And I will have Reveal fabricate the set of aligners and ship them to my office, and we'll proceed with treatment that way. I found that this is a great happy medium because the patient feels that they accomplished something that day. They felt that they were able to have their same day start. They took their records. They left with a set of aligners that day, and they developed the habits that they needed to take them in and out. I'm then able to really leverage the advantage of my digital technology that I had that available to get them started that day. But I can also utilize Reveal so that I don't have to do the entire fabrication process within my office. So for me, this is a great way to get a patient started who's highly motivated to start treatment, but I don't want to necessarily always have to do all of the aligner fabrication in my office. Because if you do a lot of aligner fabrication, you kind of have to decide if you want to be a clinician or a laboratory technician, because you would have to design and 3D print the models for every aligner and then trim them. And this can be a very laborious process. I know some doctors will have a laboratory technician available in their office or an assistant who will help them with this, but it's very challenging as the doctor if most of this is falling to you to do this work as well. So for me, kind of having the happy medium between doing a same day start with one set of aligners and then utilizing Reveal for my entire set of aligners is a great place to get started in the middle. For those doctors that are really into 3D printing that want to dive in a little bit deeper, I always recommend starting with those simple cases as well. This is an example of a case in my office where a patient had some simple orthodontic relapse. She had had an upper midline diastema open and a little bit of lower incisor crowding. This patient was highly motivated and wanted to go ahead and close that space and to realign the lower incisors. This is a great case because we don't have to make any changes to the occlusion. The patient is already class 1. And we can see that this is where she finished. So really a case that was very focused on cosmetics, but gave the patient a beautiful final result. This is a case that would take approximately 8 to 10 aligners. This is a great express case or a wonderful case to get started with a same-day aligner in your office that you can fabricate and take that highly motivated patient's records and then send them to Reveal to be used or to do the fabrication in your office. So as you look at the restorative space and the technology that you have within your office, I hope that you can embrace this new digital age. As we continue with the digital workflow for clear aligners, I hope I've been able to show you tonight how you can utilize the technology that you're utilizing in your crown and bridge world, be it your intraoral scanner, your photography with patients, or a cone beam, to utilize this also in the clear aligner space and with orthodontic treatment for your patients. Because getting the teeth into the proper position is going to give more longevity to your restorative and to the patient's natural dentition as well. So really looking to improve the patient's overall oral health care by embracing the digital technology and utilizing it for clear aligner treatment to improve their overall oral health. And really, this can help you to bring something fun to practice. I know for me, these are some of the fantastic patients I've treated in my office. All of these patients have been treated with Reveal clear aligners, and we can see how happy they are. These are adult patients that really don't want to have to wear bracket and wires on their teeth. And this can really incorporate a lot of fun into your day. These are happy patients that are happy to come in and see you and to go on their clear aligner journey and to really create their new smile. If you have any questions after tonight's program, I encourage you to connect. Probably the easiest way to find me is on social media. I use the name Aligner Bee on social media. So my fun fact for you for the day is that my first name, Melissa, means honeybee in Greek. So I share tips and tricks on Facebook and Instagram as Aligner Bee. I also run the in-office Clear Aligners Network on Facebook. I am on LinkedIn, and then this is my direct email, alignerbee@gmail.com. So please connect so that we can continue to discuss clear aligners. We have saved a couple minutes this evening so that we can take any questions. I encourage you to type those questions into the chat box so that we can continue to discuss further. We can take questions about technology and also on clear aligners.
Amazing.
Great.
Thank you so much, Dr. Shotell. What a wonderful presentation.
Thank you.
Few questions for you. And again, feel free, attendees, to drop your questions in the chat box, in the Q&A box, whatever you prefer, we'll be monitoring. But our first question for you is, when do you send out for aligners when you make them yourself?
So the vast majority of my cases, I do send out to have a lot of the fabrication done, just simply because of the manpower it takes in my office. So I have all the technology available in my office. However, you really do move from being a clinician to a technician if you are having to do the fabrication yourself. And I know right now, when we are all having really a shortage of assistants and of team members in our office, it can be a challenge to sometimes have somebody assigned to the laboratory for the day. So for me, I found that really great kind of meet in the middle point is by getting patients started with their clear aligners by doing a same day start with their first aligner. It's more of I like to think of it as a trainer aligner, since I don't typically program movement into it, since I don't want to move anything before I do the treatment design through Reveal, and then have the aligner shipped to my office. Some of the cases that I tend to do more from start to finish, utilizing 3D printing, is more when I have one of my patients come in to see me that maybe broke a retainer and didn't come back right away. And they have just a very minor amount of tooth movement that I can resolve with 3 to 5 aligners before I make their new retainers. So those tend to be those really great cases to target with 3D printing. So really a mix of both, and it kind of depends on the context that the patient comes in to see, are we going to be starting on a comprehensive treatment plan where it's a lot of aligners that it's easier for me to send out? Or is this a relapse of a patient that I haven't seen in 5 years that lost their retainer a few months earlier and wasn't able to come back and see me right away?
Great. Thank you. Our next question asks, what's the most important factors when choosing an aligner patient?
So for me, the most important factor when choosing an aligner patient is compliance. So really discussing with the patient up front the requirements for wearing clear aligners. And my recommendation, and what I tell all of my patients, is that you need to be able to wear your aligner full time, all the time, because that's the only way that the teeth are going to move. We want to make sure that the patient can wear them at least 22 hours per day. The challenge becomes is if they're in a job where they don't like wearing them, if they're working with the public a lot, if they feel that they're not willing to adapt to wearing them for speaking, those are the patients that will take them out, will set them on their desk, and then their aligners aren't fitting in a few days. So, or their teeth are just not moving. So those are the most challenging. So I like to have often my assistants, when patients are asking about aligners, my assistants will kind of give them the information before I even come to the chair as they're taking their initial records. And they'll be discussing with them the requirements to wear them full time all the time. And that it will take them 2 to 3 days to get used to speaking with them in, and that they have to be willing to go through that learning curve so that they can really embrace wearing them, because the only way the teeth will move is if they're worn.
All right, wonderful. I think that wraps up questions. We'll give it a minute or two just in case anyone has any last minute questions that they'd like to add in.
We have any questions on intraoral scanning, on technology?
Presentation must have been so good that it answered everyone's questions.
Okay, well, I guess if you have any questions, you're always able to reach out to me on social media at AlignerBee so that I can answer those for you.
Awesome. Well, thank you so much again, Dr. Shotell. What a wonderful presentation this evening. And thank you all for joining us tonight. We did record tonight's webinar and we'll email the recording out sometime in the next week. So if you would like to refer back to any of this content, you certainly can. We also would appreciate your feedback via a survey that will pop up on your screen shortly. Thank you all for joining us. We look forward to seeing you on future webinars. Thanks again, Dr. Shotell.
Great. Thank you so much.
Have a great night.
Thank you. Good evening.
Bye.